Hello friends, I am Dr. Navneet Magu, reconstructive and cosmetic gynecologist, and I am back today at the Healthcare Today. As promised to you, I am going to be talking to you today about the non-surgical vaginal tightening, or something which we also call as vaginal rejuvenation. I have already discussed with you all that what is vaginal laxity, how the vaginal laxity happens. In my previous video we deliberated upon this in detail medically. आज जो मैं बात करने वाला हूं आपसे वो है नॉन सर्जिकल वैजिनल टाइटनिंग के बारे में, जिसको बहुत सारे नामों से बुलाया जाता है. सम पीपल ट्राई टू कॉल इट एज लेजर वैजिनल टाइटनिंग, सम पीपल ट्राई टू कॉल इट एज ए आरएफ वैजिनल टाइटनिंग, सम पीपल कॉल इट एज ए प्लाज्मा वैजिनल टाइटनिंग, and various names people use. But finally the aim is to have a tight and a youthful vagina. We can also use the name vaginal rejuvenation for this. So what are the options? There are multiple options today for vaginal tightening. Vaginal tightening can be done with lasers. Vaginal tightening can be done with radiofrequency devices. Vaginal tightening can be done with plasma energy devices, and the adjuvant treatment which is required to augment the effects of these treatments in vaginal tightening is a magnetotherapy device. I am going to be showing to you also, may not be today but in a subsequent video, all these devices which are available at the El Sante Center located at DLF3 in Gurgaon. And maybe, so that you are aware that what all is required for your vaginal tightening. So number one, let's talk about lasers, and subsequently we are going to be talking about other energy devices also. So lasers, radiofrequency and plasma energy, these are three together called as energy based devices. Now there are various lasers available in the market. There are lasers which are used in proctology. There are lasers जो piles के लिए use होती हैं. There are lasers which are used for stones. Every laser is different, and vaginal laser is very different. You have to understand, a vaginal laser has to be very, very safe. So number one, you should never use an ablative laser in vagina. So the first thing which you have to check from your doctor is that the laser which he or she is going to be using for you, is it ablative or non-ablative? Because if it is an ablative laser, there are chances that there can be fibrosis in your vagina. There are chances, and I am sure you don't want to take chances for that particular reason. So number one, we need to avoid the ablative lasers. So what does it leave us with? The non-ablative lasers. Now amongst those non-ablative lasers also, you have to see that is someone using those lasers which are otherwise used for piles or otherwise used for treatment of the veins, varicose veins, because I hear these days that many people are trying to use these lasers also for vaginal tightening. So either you are not going to get the results, or probably it may also damage you. So you have to use a very, very safe laser if you are going to use a laser for laser vaginal tightening. Globally, all over the world, there are two lasers which are standard and have proven efficacy and safety. Effect और safety दोनों prove की है. Number one remains a non-ablative erbium YAG laser which is made in Europe. It is a European laser which comes by the name of Photona Intima laser. So this is a erbium YAG non-ablative laser, and using a robotic handpiece, it is probably the number one technology which is today used for vaginal tightening. You can call it as the laser vaginal tightening, you can call it as the non-surgical vaginal tightening, you can call it as vaginal rejuvenation, but it has proven its safety, it has proven its efficacy in various studies done across the globe. So that is one option which you can choose, you must check that if your doctor has got a Photona laser and a Photona Intima laser for treating you. You have to see, because the laser, there is written Intima laser. Number 2, and it should preferably be a robotic handpiece, because the precision with the robotic handpiece, which is also called as G-runner, is amazing. It has proven that it does not leave even a single millimeter of your vagina untreated. So that is the number 1 option. There is also another laser which comes with the name of Mona Lisa Touch, which is minimally ablative but has proven, evidence-based proven, that it does not cause fibrosis. All other lasers which are available in the market, they either have not proven their efficacy or have not proven their safety. So you need to check from your doctor that he or she has got either one of the 2 devices. Both of them are made in Europe, one in Slovenia and one in Italy. The next choice is the radio frequency. Now, there are multiple radio frequency devices available in the market, and the number 1 which was most popular, which came the first, was Thermiva. So Thermiva is a monopolar radio frequency device which can be used for vaginal rejuvenation. There is a difference between the laser and RF tightening. Laser definitely would give you much better results for tightening than the RF, but the RF is also very safe, provided the RF is one of the standard temperature controlled RF. Because if your RF provider has a Chinese or a Korean kind of RF which does not have the temperature control in this, it can lead to scalding or burning in the vagina. So you have to be very, very careful that what machine is being used. So Thermiva is one machine. It is again made in Europe and marketed by an American company, and it has also got a manufacturing facility in the United States of America. Then you have Exelis, which is another nice RF machine, again a monopolar RF, which is marketed by BTL and again made in the Czech Republic in European Union. Then you have another which is called as an Empower RF, which has again got a RF which is a bipolar RF. The monopolar RFs give a little better result when it comes to a comparison between monopolar and bipolar, but more or less both of them are the same. So you can use one of these 3 RF machines, and the next RF machine which is very safe is the Venus Concepts Fiore, which is made in Canada and marketed by a Canadian company. Now, any of these 4 RF machines, if your provider has, they are safe machines. There are many such RF machines now available in the market which are Chinese, which are Korean, and they have not proven their safety and efficacy. So please be cautious. Check from your provider that what machine they're going to use on you, and is it original or is it a pirated machine. The third energy-based option for a non-surgical vaginal tightening is the plasma energy. Now, plasma is a new form of energy-based device, and it has actually revolutionized the whole thing, because besides the thermal energy which the lasers and the radio frequency uses, it also has a biological way of effect. It causes something which is called as a reversible depolarization, which opens up the cells in the vagina, the pores, micro nanopores in the vagina, and gets the nutrients in those cells, creating immediate effect on collagen formation and tightening of vagina. Besides, of course, having the thermal effects like the good lasers or the temperature controlled radio frequency machines have. So we will be talking more about other devices. We will be talking about magnetotherapy, and definitely I will come back to you here again when we will talk about each and every device what I have mentioned in detail. We will sit next to the devices. We have got all these devices at the Elsente centers in Gurgaon, in Mumbai and in Hyderabad. We've got the top of the line, the best equipped devices for you here, which are very, very safe. But I'm going to be showing you these devices. I'm going to be talking individually about the pros and cons. I'm going to be talking about the various effects these devices can produce and to what level vaginal tightening can be done. Now, what is very important is that even if all these devices are available, but the provider is not trained adequately in usage of these devices, and more so before that in selecting the right patient, in doing the correct gynecological examination on you, and then seeing that are you the right candidate for a non-surgical vaginal tightening or not, is extremely important. So two things, be careful. Number one, your doctor should be a trained cosmetic gynecologist, your provider, and secondly, they should have one of these devices. We have mentioned a lot of devices. One of these devices which have proven their safety and efficacy, and they have got publications in peer-reviewed medical journals which have proven these aspects of safety and efficacy, because our medical ethics do say, first do no harm. Even if I am not able to do good to you, I should not do harm to you. Safety is paramount. So the doctor has to be trained to examine you, choose you that you are the right candidate or not, has to have the right paraphernalia, the right device, has to be adequately trained on that particular device so that you can get the benefits of the best trained hand, the best device performed on you in the best possible manner, so that what you get is your desired results. That is extremely important. We're going to be talking more on that. You stay tuned with us here, and I can assure you, you will not do a mistake in choosing the right provider for your requirements. So here we will say it okay for today, over for today, and we will come back to you soon with interesting stuff on these issues, because we care about you.